My name is Kelsey Moon. I'm a student nurse at the College of Nursing, and today I'll be performing an IV saline checkoff. So I'm going to first start by verifying the order in the hospital policy. So I see we have an order to insert a saline lock in the morning for CT scan. So I'm going to gather all my appropriate equipment needed for that and perform hand hygiene. So next, I'll identify my patient using two identifiers comparing with the medical record and my patient's armband. So we have Jaguar Jones, medical record number 4176352, 4176352. I have it noted on both my patient's chart and armband that he's allergic to penicillin. Mr. Jones, I have it noted here you're allergic to penicillin. Do you have any other allergies that need to be made aware of today? Okay, Mr. Jones said today I'm going to be inserting an IV into you before you head up to CT this morning, if that's all right with you. Okay, so after explaining the procedure to my patient, I'm going to provide privacy to them and we'll position my trash can and perform additional hand hygiene. I will now don my goggles. Excuse me. So from here, I'll then raise the bed to a good working height, lower the side rail, and make sure my patient is in a position of comfort, either in a supine or sitting position. And we'll maintain privacy to him throughout the entire procedure. So now I'm going to open my packets using sterile technique. So then I can organize my equipment. So I have my tape. So I'm going to go ahead and prepare 2 pieces of tape. So then I'm going to take an alcohol swab and I'm going to cleanse my tubing. And I'm then going to attach it to my tubing, excuse me. I'm going to first prime the tubing, and then I'm going to firmly attach it to the catheter. And then while maintaining sterility, I'm going to go ahead and loosen up this protective cap on the catheter. And then I'm going to place this back into its appropriate containers until it is needed. So then I'm going to open up my over-the-needle catheter and remove them from its package. And I have my dressing removed from its package as well. So when selecting a vein, you want to choose the most distal site on the non-dominant arm if possible and select a large, soft, spongy, or bouncy vein, avoiding any areas of pain, bruising, infection, infiltration, or wounds. So to foster that venous ascension, you could gently stroke the vein lightly, apply warrants of vasodilate for several minutes, and place the extremity in a dependent position. So now I'm going to place a waterproof pad up underneath my patient's arm. And then I'm going to take my tourniquet and apply that 4 to 6 inches from my selected site. So then I'm going to check the radial pulse, and I'm just assessing the vein for appropriateness. Okay, so then I can don a pair of clean gloves. So while keeping the saline lock in its sterile container, I'm going to move it closer onto the bedside table. And then I'm going to use my chlorhexidine prep and vigorously clean the site using friction. So I'm going to cleanse horizontally, vertically, circularly for at least 30 seconds. and then allow that site to dry, and then not touch it since it is sterile at this point. So then I'm going to demonstrate performing a venipuncture. So I'm going to anchor the skin 1/2 inch to 2 inches from the selected site by stretching the skin against the direction of the insertion site, making sure to not touch obviously where I just cleansed or allowing the opening catheter to touch it. So Mr. Jones, I'm going to advise you just to stay still and you're going to feel a slight stick. So while I have the bevel side up, I'm going to insert the catheter at a 10 to 30 degree angle, assess for blood. And then once I note that, I'm going to lower the needle and advance it another 1/4 of an inch. And then advance the catheter all the way up to the hub without advancing the stylet. And then I'm going to stabilize the catheter and then quickly remove my tourniquet. Okay, so I'm going to use gentle but firm pressure 1/4 of an inch above the insertion site and then slowly remove the stylet. And then dispose of that into my sharps container. So then I'm going to quickly remove the cap and then attach that to my catheter. So then I'm going to temporarily secure that to my patient. So now I'm going to reassess for blood return with gentle aspiration, and then I'm going to flush the remainder of my saline into the vein, observing the site for any swelling. So then I can remove the flush syringe and dispose of that in the sharps container. And then I'm going to allow the catheter or the IV to remain in a natural position. And then I'm going to stabilize that. And then I'm going to apply sterile transparent dressing up to the hub of the catheter without touching under the dressing, and then leaving the connection below the extension set and the hub uncovered. So then I'm going to remove these outside edges and then just make sure the dressing is adhered completely to my patient's skin. And I'm going to save this because this has a label I'm going to use in a little bit. So then from here, I can remove of my equipment. And my clean gloves. So then I would take my label and label it with the time and date, the gauge I used, and my initials. And then I'm going to apply that to the outside edge of the dressing. So I would then reposition my patient for comfort. So I would raise the side rails and lower the bed to its lowest position. And I'm going to teach my patient ways to prevent dislodging of the IV and signs and symptoms of IV complications. So then I would perform hand hygiene. I would then go and document the date and time I performed this, the location of the insertion site, the number of attempts it took, catheter gauge and length, how my patient tolerated it, presence of saline lock, or flow rate and method of the infusion if fluids were prescribed. So now I'm going to demonstrate discontinuing the saline lock, again making sure to maintain principles of asepsis and homeostasis. So I'm going to apply a pair of clean gloves. So I'm then going to remove the transparent dressing towards the side of insertion. So I'm just going to lift up the edges of it. Again, just pulling all edges towards the insertion site, and then dispose of my dressing. Even though it's completely stuck to my glove. So then I'm going to take a clean gauze and place that up at the tip of my catheter. So then using my dominant hand, I'm going to slowly withdraw the catheter. Making sure that I keep the hub parallel to the skin. So then I'm going to hold pressure for at least 30 seconds, and then I'm going to inspect the catheter for intactness, and then I can dispose of that properly. So then I'm observing the IV site for any evidence of complications such as redness, pain, tenderness, swelling, or bleeding, which I do not see. So then I can use another piece of gauze, another piece of tape to secure my gauze down. So then after that, I would be able to reposition my patient for comfort and raise the side rails and lower the bed and make sure my patient has call light in reach. So then I can dispose of my gloves and my equipment. And that completes my checkoff.